one of the things that is increasingly recognized is that with most of the newer treatments that are being used, we are, of course, seeing incremental advances. And in particular, the greatest benefit is always seen in the patients with standard risk disease. So now when you contemplate using, a quadruplet regimen as induction followed by transplant with maybe subsequent consolidation and maintenance, you're looking at really long treatment-free intervals potentially in the future, or certainly patients being on maintenance therapy for a very long time, being free of progression. But unfortunately, we're not making the same inroads into the treatment and prognosis of patients with high-risk disease. So even though the advent of monoclonal antibodies, such as daratumumab, has led to some improvement in the outcome of these patients, they still lag way behind. And there are still a number of settings in which there's very much an unmet need. And once, of course, patients have exhausted the different treatment modalities such as proteasome inhibitors, immunomodulatory drugs, and monoclonal antibodies, then in the absence of other newer investigative therapies such as cellular therapy, or I guess other things like BiTEs, the prognosis is really quite dismal. And this is, I think, the context that the more recent results with CAR T cells need to be seen in. Though we're not seeing a plateau on the survival curve with BCMA CAR T cell therapy, nevertheless, we're seeing a very high response rate in patients who've exhausted all other available treatment options. And we're seeing, quite a degree of durability given where those patients are, even though it does look like they're all destined, or most of them are destined to relapse. Nevertheless, the progression-free survival for patients getting the Janssen, BCMA CAR T in Cartitude study looks quite promising and is going to be updated shortly at ASCO. But, again, just getting back to the logistics of all of this, developing a bespoke autologous product for patients who are in dire, desperate need is a very, very tall order. And that means that on an intent to treat basis, that a proportion of patients just end up not receiving the treatment because their disease has progressed, or in some cases just not possible to collect enough healthy T cells to generate the product. So this is where, again, the role of allogeneic products is coming in. With T cells, it's a lot of work to make an allogeneic off-the-shelf T cell product. It requires a lot of gene editing to mitigate against the potential for graft versus host disease. So instead, I think this is where other platforms such as NK cells can be very important, because we know it's safe to give NK cells, that they don't induce graft versus host disease. And in fact, from a safety point of view, there doesn't appear to be a signal that they induce cytokine release or neurotoxicity either.